I have no financial disclosure. An optimal age of surgery is still debated, but we know that early surgery prevents further loss of binocular vision and restores stereopsis. And also, eye alignment is very important in child development. What's the background for early surgery versus late surgery? It's from the 20th century school of treatment philosophy by Wirth and Chavas. This is like nature versus nurture theories. Wirth, in 1903 book, he suggested that isodeviation results from primary motor fusion defect, so that secondary sensory deficiency is always there, and due to this inborn defect in the fusion potential, surgery is just for cosmetic reasons. On the other hand, Chavas suggested later that this is like a conditioned reflex, and if we try to fix this one, binocularity can be restored. So the strabismus surgeons influenced by Chavas' theory have performed earlier surgeries in the following years. And Kostenbader defined infantile esotropia and reported 1 in 5 children could have gross stereopsis if they are aligned by age 1 years, and this was published in 1961. Later there are more studies, but I would like to emphasize some important ones. From Birch and Sager group, they reported 3 important results from 50 infants. They reported that stereopsis emerged in human beings during the first 3 to 5 months of life, and normal babies and esotropic babies can have capacity for stereopsis if they are aligned. And if this capacity is not restored, it is not only arrested, but it will degenerate with time also in few months' time if left uncorrected. And later, Wright reported a case who was operated at the age of 3 months. Actually, this was his son, and this child had good stereopsis. And later, he reported 5-year follow-up of children who were operated at 4 months of age, and these children had 100% motor fusion, and 60% of them had random node stereopsis. And also, later studies show that onset is important. We should correct this deviation in plastic period, but shorter period of deviation is better. Birch group also showed that excellent outcomes may be achievable if the infants are operated within 60 days of onset of strabismus. So as you can see in these graphs, there will be better results if these children are operated with a short period of deviation. And also, when we look at the longer results of this early surgery, when the children are operated in 6 months of age, they will have better fusion in almost 80% of the cases, and better stereopsis when you compare with the children who were operated between 7 to 12 months of age. And in another study, Trichonolos used a mathematical model and analyzed 3 hypothetical ages: 6 months, 24 months, and 48 months. And at the age of 8, he reported that advantage of having eyes aligned for a longer duration will give better stereopsis. And he suggested that it's probably warranted to attempt correct large angle esotropia as early as possible. So from these studies, we know that earliest age with short period of deviation, this will give you more time for better development. And also from animal studies, you may know about this one, this famous study by Huban and Wiesel. They got Nobel for their study in 1981. In animal model, they show that there is anatomical changes in the brain if there is deprivation. And this study also shown in human beings in cadaver models by von Norden. There will be anatomical changes in the brain if there is strabismus, and if this is late, if there is a delay in the surgery, there will be decrease in cellular size in lateral geniculate nucleus. The good news, this is reversible. And there are more studies, later studies that were conducted in animal models, in congenitally isotropic monkey models, and all of them show that early correction will give you normal eye movements with better binocularity. There's a study from Europe, also early and late infantile strabismus study group. In this one, the early study was at 2 years of age, and at the end of study with 6-year follow-up results, they show that almost 4 times better stereopsis in early group. And it's not just stereopsis and amblyopia, but we know that motion detection and motion VPs will be affected in infantile esotropia. And also, Birch group showed that there will be improvement in the nasotemporal asymmetry in children if they are operated early. And from other studies also, we know that early strabismus repair is beneficial for cortical development in human infants. And this is also, again, supported by animal studies in different groups. The correction of the strabismus is not important for eye or visual development, but it's also important for the general motor development of the baby. And sensory motor problems were shown in infantile esotropia patients. And if we correct esotropia, this will have beneficial effect on motor development of the babies. I know that my colleague will tell you about spontaneous resolution, but from previous studies, observational study of congenital esotropia, and from pedic studies, we know that esotropia more than 30 prism diopter will not resolve spontaneously. Almost 89% of them will persist. And also, he may say about anesthesia and examination techniques, and with the new advancements in the anesthesia and also with the studies, we know that if there is differences in the examination, this will not affect the result. So infantile esotropia is a common health problem. We have difficulties in treatment of this, but with early surgery, with short period of duration of surgery, this will give chance better development for the child. For long period of development, they will have better alignment. And apart from that, if I were not a doctor, if I were not an ophthalmologist, just being a mother, I would like to have eye contact with my child, with my baby. And even though this baby with the crossed eye, she's very cute, but I would like to have the eyes aligned if this were my baby. And if you look at this child with crossed eyes, he is not looking very smart, or she's cute, but when the eyes are aligned, she looks better. So thank you for your attention. I hope you change your mind.